for joining us today. This is our second question and answer session with your Facey Pediatricians. I'm Dr. Castelblanco. I work in the Mission Hills Clinic, and this is Dr. Ruth Zapanian, and she works in the Copper Hill Clinic. So today we are going to talk about summer safety. So we have lots of tips and tricks for you guys to keep yourselves and your children safe, protected from the sun. We'll talk about pool safety. And so as with all of our sessions, we like to mention that if there are any specific questions that you have throughout this presentation or at the end about your child, the best person to talk to and reach out to is your pediatrician. They know your child the best, and they can have specific recommendations for your child, for their age range. And so this is by no means supposed to be an all-inclusive, everything you need to know presentation, but just some of the most important things that we think are relevant, especially during these really hot summer months that are currently going on. Ruth, do you have anything to add?
No, it's an honor to be doing this again, and I hope you enjoy it. Thank you.
Awesome. So with that, we will go ahead and get started. So our first question is, I talked about sun protection. So how do I protect my child from the sun? And a follow-up question is often, well, what kind of sunscreen should I use? So I'll go ahead and take this one. So the first rule to sun safety is just try and cover up, stay in the shade. So especially for small children, so less than 1 year old, and I would say for all children, but especially the small children, really protecting yourself from the sun and staying in the shade and covering up is the easiest way to protect yourself from the sun. Sunscreen can be worn, and I do recommend it for children that are 6 months and older. Less than 6 months, try and just keep them in the shade, keep them covered, have that hat on, try to avoid prolonged exposure to hot, direct sun. But 6 months and older, we do recommend that you put on sunscreen. So we recommend SPF 30 or greater is a good high-grade sunscreen, broad spectrum, and really try and have it to be chemical-free. So 2 components that you're looking for in a chemical-free sunscreen: zinc oxide and titanium oxide. So those are the 2 most common ingredients in chemical-free sunscreens. They're also known as mineral-based sunscreens. So apply a nice thick layer all over the body, even on the face, and then you do want to reapply the sunscreen every 2 hours if you're going to be in the sun for a prolonged period of time. Now, if you're in the water, you're in the pool, you're in the lake, you might need to reapply that sunscreen a little bit more frequent than every 2 hours, because as you can imagine, it will wash off. And also try and give it a little bit of time between putting on the sunscreen and going out into the sun or going into the water. So try and put it on at least 20 to 30 minutes prior to the sun exposure, prior to your activity. We do want to try and prevent sunburns, especially in small children, because not only are they uncomfortable, painful, but they can also increase your chance of skin cancer later on. So sunburns are more dangerous as a child than they are to us as an adult. But of course, for anyone, we want to try and prevent those really uncomfortable sunburns. Anything to add, Dr. Zapanian?
I completely agree. And I want to also reiterate, I love the mineral-based sunscreens. Those have been around for ages. They've been very safe and effective. The only thing is, you might notice it might cause like a little film, like a whitish or sometimes colorful tint on the skin, and that's perfectly fine. And once you see that tint sort of fade, that's kind of when you start realizing maybe I need to reapply. So it's a really good indicator. And generally, I do try to stay away from the chemical sunscreens, as those are, there was some information, new research coming out, and we're learning more and more about it. So I would say for now, to be on the safe side, I recommend we continue to use the mineral sunscreens and, of course, avoid sun exposure if possible, especially for the younger ones under 6 months of age. Yeah. And
Perfect.
yeah, of course, if anything, like in terms of what SPF to use, I think that also varies based on your skin type as well. So be sure to check with your primary care doctor to see which SPF would be best for your skin.
Great. Yeah, I
Yeah.
totally agree, Dr. Sapanian. And I will add, for lots of my teenagers, if you're worried about your acne, sun protection, also very important. So sun protection is important all year long, not just during the summertime. Particularly for my teenage girls, they do sell mineral-based kind of tinted sunscreens. If you are wanting to have like a nice layer on your skin, in lieu of using like a thick powder for your makeup. So that's for the older kids, of course. So we're getting into our second question. So we'll talk about sunburns. How do I treat a sunburn? So if you get a sunburn, what do we do? So first thing is to try and cool off the area. So give your child a cool bath, so it cools off the skin. You can apply, if it's a mild sunburn, you can apply a topical aloe vera. That seems to be pretty gentle. It's natural. For minor burns, that's usually all you really need. And of course, cover up, prevent that area from being exposed to the sun again. So protect that area. Again, if it's a minor burn, the aloe vera, but also wear sunscreen on that area if you are going to continue to be outside. If it forms a blister, so sometimes sunburns will form one big blister or multiple small blisters, do not pop the blister. So blisters are nature's Band-Aid. So there are lots of cells that are coming into that area and trying to heal the skin. So don't pop the blister voluntarily. If it pops all on its own, that's fine, but keep it covered. So the main thing is keeping it covered. If it is a really severe burn, so if you're seeing lots of blisters or lots of open skin, it's really painful, or if it's on a significant area of the body. So if you have a sunburn that spans a large area of the body or a sunburn in a really critical area. So the face, if it's near the eyes or the mouth, or in the genital area. First of all, try to avoid sunburns, of course, in that area. But if you do get a sunburn in those sensitive areas, or if it's a severe sunburn or on a significantly wide area of the body, then it is a good idea to be seen by your doctor. You can be seen at an urgent care or in the emergency department. It may require some additional wound care. If you're doing wound care at home for some minor burns and the blisters, you can also use an over-the-counter topical antibiotic ointment. So like Neosporin is very popular. So you can use that to prevent infection of the open skin. Anything to add, Dr. Sapanian?
Think you did a great job. You covered it all. Yeah, absolutely. I just got that question today from one of my patients, and everyone's tempted to pop the blister, but I encourage you to leave it be and let nature heal the sunburn. Absolutely.
Great. So we're moving into maybe more of a tricky question. How
Mhm.
much water should my child be drinking? We get that question a lot because it's so hot. We want to keep kids hydrated. Dr. Sapanian, did you want to take this one?
Sure, absolutely. So, a lot of kids under the age of 2, I find it really hard to give a general answer. I usually want to see how much milk they're drinking, how much, if they're infants, formula they're taking in, or breast milk. So it really helps. And but a good rule of thumb is make sure you're getting good wet diapers for infants and children under the age of 2. And then for older children, I would say between the age of 3 and 8, a general rule of thumb is to get at least the number of ages that they are, the same number of cups of fluids per day, ideally water. So suppose they're 3 years old. I'd hope they get maybe 3 cups of water per day. If they're four, maybe 4 cups of water. And then as they get closer to age 8, you increase it, and then 8 cups by age 8, and ideally continue on at that pace. Of course, if you're sometimes drinking maybe 2 cups of milk, you might be able to subtract that from your water intake. But most importantly, if you're outside, if you're in the sun, make sure that you increase your water intake to prevent any dehydration. I don't think there's always a simple answer in terms of how much water to drink, mainly because our body types are different, our weight is different. And so it always helps if you want to know the specific amount of how much fluids you need, best to ask your doctor as well. Any thoughts, Dr. Castablanco?
I totally agree. Water is really the best hydration that you could have. So do try and avoid too many sugary beverages on a daily basis because those don't provide wonderful hydration. So, like Dr. Sapanian said, if babies are drinking formula, if you're drinking milk, that's great. But then your main fluid is going to be water, especially in the older children. So do try and avoid reaching for that Gatorade, for the soda, for the juice. In certain circumstances, Gatorade is appropriate. And again, I would talk to your doctor about when those circumstances are. But in general, water is great and we need to stay hydrated. So perfect. Uh,
Absolutely.
so moving on, our next question is about bug bites and mosquito bites. So how do I prevent bug bites and mosquito bites? What do we do, Dr. Sapanian?
Great question. So usually, the best thing to do is to prevent exposure. So if there's a large body of water, if we have any like sitting water around our house, like a bird bath or bucket, we try to eliminate those because they tend to attract insects. Of course, if we are going to be in an area where there are going to be mosquitoes, perhaps we're going camping or we're going outdoors. Those would be areas that I would say, if we're going to be there, let's take all the necessary precautions. And I recommend using 10 to 30% DEET. This is something that you can use for infants ages 2 months and over. It's safe to apply. Of course, if you're going to use it on the body, it's best to stay as covered as possible. So if you can wear long sleeves, that's the best way to protect your skin, is through long sleeve clothing. But of course, there will be areas that would be exposed, such as your face, your lower extremities maybe. So with those areas, apply the DEET to protect yourself. And then you can always use, if you're going to be outside for younger infants, a mosquito net would also be ideal to protect the children from any potential mosquito exposures as well. Absolutely. Any thoughts, Dr. Castablanco?
That sounds great. I would just add, if you are going to apply the bug repellent, so the DEET, to the face of a child, it does come in a spray. So don't spray it in their face, just spray it on your hands and just pat it gently on their face just to avoid the eyes, because that could be pretty irritating.
Yeah, good
So
point.
great. So what happens if we get a mosquito bite, if we get a bug bite? How do I treat that?
Oh, great question. Great question. And I think we see a lot of kids for mosquito bites, and many of them can be treated at home. There's a few things we want to address. The first thing is that it's an irritant. So it's very irritating. If you do see a stinger or anything like that, remove it. So that's step one, removing any foreign body, such as a stinger or anything that you see that should not be there. The next step is to control the itch. And the itch is best controlled initially with a cool compress. So if you have a cool compress, apply it to the area. That helps reduce both the inflammation as well as the itchiness to the area. And then other things we could do are we could take oral antihistamines like our Benadryl or Zyrtec, And generally, I recommend using Zyrtec in the daytime and Benadryl in the evening to avoid any sedation during the daytime. And then, of course, if the particular site is very itchy still, you can always use over the counter hydrocortisone cream. Those are available like the cortisone 10. You can use that and apply it twice a day, usually for about a week, up to 2 weeks. And then, of course, if you need to use like a calamine lotion or any other moisturizing lotion, you're more than welcome to do that as well to prevent any itching. Any other thoughts, Dr. Castablanco?
I do just want to mention, so you mentioned two really great medicines for itching, Zyrtec and the Benadryl. So Zyrtec is a 24-hour medication, so we just want to give it once a day as needed for the itching. And as with all medications that we mentioned, please talk to your doctor about what the appropriate dose is for your child. But in general, Zyrtec should last for about 24 hours. Benadryl will last from about 6 to 8 hours. So it is a faster acting medication, but it lasts for less hours. So again, talk to your doctor about when that would be appropriate to give. Um, in general, it's safe for babies as young as 6 months old to take Zyrtec. Benadryl is recommended maybe for the older kids, but in some situations it may be appropriate to use in your young child. So again, just reach out to your doctor, but they may recommend those medications. Another couple allergy medicines that you might hear out there are Claritin and Allegra. They are very similar to Zyrtec. And again, just touch base with your doctor about what would be appropriate for your child.
Yes.
Great.
Awesome.
So continuing on with the theme of bug bites. So what happens if you have a bug bite? It's looking concerning. When
Mhm.
should I see my doctor for a bug bite?
Great question. So, first and foremost, our doors are always open. If you ever have a concern, question, anything, give us a call, make an appointment, come on in. But I would say there are some definite points that I would say you really want to go see your doctor. So, of course, some people are allergic to certain bug bites, especially like when we think of bee stings, some people are might be allergic to them. And generally, those kids might present with immediate onset swelling, wheezing, throat closing, breathing changes. Any of these sudden changes that are severe, they need to be taken to the ER right away. Those things I would say rarely occur, thank goodness. But if it does occur, something that needs to be addressed right away. Otherwise, for your general bug bites, of course, sometimes with kids, we love to scratch and we love to get in there, and that in itself can increase the risk of infections. If you see that the bug bite site has increasing redness, it's painful, it's becoming more swollen, or of course, if there are any fevers, these might indicate that an infection might be starting, and that would be a good time to make sure that the child gets seen either at your primary care doctor's office or at the urgent care if needed. And then, of course, if we can prevent the itching by applying the topical and oral medications, that would be the best way to prevent those secondary infections, as infections by itself is very, very rare, and we don't usually see it as very often. All right, any thoughts?
I agree with all those things. I totally agree that infections from bug bites are rare. Bug bites will often cause some redness and itching, maybe even some pain and swelling at the site of the bug bite. Sometimes they can even cause a little bruise. And these are normal reactions to a bug bite that are likely not infection to a certain point, of course. If those symptoms are becoming extreme, then that is when we do worry about infection. However, as I've said multiple times, if you are worried about it having become an infection, the best thing to do is just to have us check it out. But just bear in mind that we won't always prescribe the antibiotic because thankfully it won't always be an infection. So if your doctor tells you it doesn't look like an infection, looks like we can just treat it at home, that's very good news. But if it is to that point where we are worried about infection, then your doctor will definitely take care of that. So excellent. Our last question, probably one of our biggest questions, especially in the summertime, is can my child be around the pool? Is it safe to go into the pool? And so the biggest thing with pool safety, and I'll go ahead and start this one off, is supervision. Never ever leave a child unattended when they are in or around the pool or any other body of water. And that means an adult must be supervising them at all times, not being distracted. So, non distracted supervision. If there are young children, it is best for the adult to be in the pool with the child. And again, if you have many children in the pool, it would be best for there to be more than one adult keeping an eye on the group. So children, even if they know how to swim, can drown very quickly. And drowning, unfortunately, is one of the leading causes of death in small children from 1 to 4 years old. So this is very big. Most times that kids do drown, it's when we were least expecting it. So not during a pool party where you know that they're going to be in the pool and you're supervising them, but usually when there is unintended access to the water. So that brings in the pools that we have in our homes or even the public pools. You should always have a fence around the pool on all 4 sides. That's the best protection. The fence should be at least 4 feet high, and it should have a gate that latches and locks well. And the latch should be out of the reach of small children. Children are smart. They're very clever. They're sneaky. They will find a way to get to that latch and unlock it and get into the pool when you least expect it. So just keep that in mind if you're at someone else's pool or you have a pool. Make sure that those protections are in place. As far as swimming lessons, so I do think swimming lessons are great, definitely encouraged. That does, help prevent drowning if a child actually knows how to swim, but should not be relied on for safety. So just because your child has taken swimming lessons and has shown to be a strong swimmer, they still need to be supervised and those precautions still need to be taken. So talk to your doctor about when swimming lessons are appropriate to start for your child. Most children can start swimming lessons by 1 year old. Less than 1 year old swim lessons haven't really been shown to lower drowning risk, although I know there are places out there that will offer swim lessons less than 1 year old. But again, in general, 1 year old and above swim lessons are pretty safe, again with supervision, but less than 1 year old, you'll want to talk to your doctor about that to see if that's appropriate for your child. Lots of people like to use floaties. It gives kids and adults a sense of security. So floaties, I would say, are not truly recommended because, like I said, it does give parents and children a false sense of security. Oh, they're wearing their floaties. They're fine. They're not going to drown. They're just floating there. Nothing's going to happen. So if you are using floaties, that doesn't change the vigilance with which you need to supervise your children. If it's a child that does not know how to swim and they have floaties, you still need to pretty much have 1 or 2 hands on that child at all times. Don't take it for granted that the floaties are going to save your life. And actually, in the packaging or the labels on these floaties for the pools, they do say that these are not life-saving devices. So that it even says that on the packaging, which I appreciate. And speaking of life-saving devices, if you're around water that is not a pool, so if you're out on the ocean, on a boat, or on a lake, and you're with your children, they should really be wearing a life jacket that fits well. So if you are near or around lakes, rivers, the ocean, a life jacket is recommended. You just never know, and that could actually save their life. Um, and parents should know CPR. So there's lots of free CPR courses that you can find in the community, but there's also lots of videos online that you can just look up. But it is important and recommended for parents and other caregivers, grandparents, anyone who's going to be supervising the children around the water to know CPR in the event of something unexpected happening. That's important to know. The last thing I'll mention is something that's come up recently with teenagers having breath holding competitions under the water. So not recommended. It's never recommended to try and hold your breath as long as possible, and it is particularly dangerous if you're underneath the water, submerged, trying to hold your breath for as long as possible. There have unfortunately been cases of teenagers, strong swimmers with no issues, that have had serious problems with almost drowning or almost drowning by having breath holding competitions. So in general, if you're in and around a pool with your children or any body of water, children must be supervised. Keep them away from areas where there's water when it's not pool time or swim time. We want to try and prevent drowning at all costs. Drowning can happen even in very small pools of water. So we were mentioning getting rid of the water in the bird bath. That's also a good idea to prevent drowning in small children. Removing that bucket of water that's accumulated outside in your yard. Anything like that. Bath time, I know we're talking about summer safety and pool safety, but bath time is a big daily time where kids are exposed to water, and they can drown just even in the bathtub. So the saying that kids can drown in a puddle of water is remarkably true, unfortunately. So it's kind of a sad note to end on. But any thoughts, Dr. Sapanian?
I completely agree. And I think a lot of us think of, oh, my door's usually locked to the pool. Like, no one's going to go there without my knowledge. But I want to reiterate, having that fence on all four sides of the pool is very effective. And the American Academy of Pediatrics has very specific recommendations, like you mentioned, about how the fence should be. And I think it's because we do unfortunately see so many cases of unintentional exposure to the pool and drowning. So I really encourage parents to see and get those safety measures at their house. And of course, if there are any other specific questions, like in terms of the infants swimming at younger, under the age of 1, definitely talk to your pediatrician. And of course, feel free to let us know if anything comes up or if any concerns, by all means. Yeah, thank you so much.
Great. So I think with that, those are all the questions and answers that we have for you today. So even though we talked about all these things to be careful of in the summer, do have fun. All these precautions are to facilitate you and your families having a good time during the summer, doing the activities that you love in a safe manner, giving you peace of mind that you're doing the right thing, that you're protecting your children while you enjoy your time together over the summer.
Yes, have fun.
All right, so we'll see you next time on our next Q&A.
Take care. Bye, everyone.